We are excited to have you here today at St. Ambrose University for this free CEU course. Today, we will be discussing the applications for baby wearing in occupational therapy practice. You can find the objectives for this course listed below the video, where you will also see a link to a survey that you can complete, after which we will send you a certificate of completion for viewing our course. So to get started here, let's just do a few introductions. I'll go first. My name is Jenni Green. I've been an occupational therapist for about 8 years. I have a bachelor's degree in psychology from St. Ambrose University, after which I attended Colorado State University for OT school. And my practice area is mainly with adults, more specifically the brain injury population in hospitals and inpatient settings. But I now teach at St. Ambrose University in the OT program for about a year. Our next host today is going to be Dr. Julie Jones, one of my colleagues. Julie, would you mind telling us a little bit about yourself?
Sure. I'm Julie Jones, and I'm on faculty here at St. Ambrose. I joined this team in 2017. Prior to working here at St. Ambrose, I practiced as a school-based therapist, but also an early intervention therapist for 14 years. I've been an OT since 2003, so almost 20 years.
Awesome. Thank you, Laura, or thank you, Julie. Our next guest I'm skipping to is Laura Benavides. She is an occupational therapist and a certified baby wearing educator, and we are so excited to have her. Laura, would you mind telling us a little bit about your OT practice and your background?
Sure. I'm Laura. I've been in OT for, almost 8 years now. I also went to Colorado State University with Jenni. And we graduated in 2015. So after that, I went into early intervention and acute care. So I've always kind of had a foot in pediatrics, but I did start, my roots are in acute care. But about 6 years ago, I started working in an outpatient pediatric clinic, and then that became my full-time job shortly afterwards. So my real passion is pediatrics, especially kind of that early intervention age group, and kids with autism are kind of my big part of my caseload, and that's my big passion.
Awesome. Thank you. So what are you going to share with us today about baby wearing, and how did you become so interested in this topic?
So I became really interested in baby wearing after I had my own kiddo almost 2 years ago. He was one of those babies that never wanted to be put down. So it was kind of a necessity for me. And there weren't really any resources for me to figure out what to do. My mom never really was a baby wearer, and none of my mom friends really knew much about it. So I went to YouTube and I started watching videos, and I started joining Facebook groups and looking for support near me. And I really got into it after that. And once I started wearing him and noticing, how much happier he was, how much easier it was for me to respond to his cues when he was right there on me, and how much more convenient it was for me to have my hands free with a small baby. I got really passionate about it and helping other moms learn how to baby wear safely. So I'm going to share some things about safety with baby wearing. I'm going to share some ideas about how I think OTs specifically can really support our clients with baby wearing, and how we can help our client population, because I do think that there are a lot of applications within this for occupational therapy specifically.
Awesome. I mean, you listed off a few benefits already, just being a mom and learning how to baby wear, but what are some more benefits that mom and baby can expect from baby wearing?
So there's actually a lot of research for skin-to-skin contact and kangaroo care, and we kind of take that and we apply it to baby wearing as well, because the research on baby wearing itself is more limited. But it's so similar to those concepts that we look at that research to see the benefits, and we see that babies who are worn or who are held more frequently during the day are calmer, they cry less, their stress levels are lower, their parents' stress levels are lower. Their parents feel more confident and competent. And it even has ramifications for breastfeeding if you're breastfeeding. It can increase milk supply. It can increase success with breastfeeding. There's some research with foster care as well that this can promote a more secure bond between infants and caregivers, even if they're not biologically related. So it's really great for those kind of social emotional pieces. It's also good for physical development, which I think we're going to chat a little bit more about later, but just to kind of touch on it briefly, it keeps baby in a nice upright position where they are engaging their core muscles, and it keeps them off the back of their head, which we know when we're laying all the way on the back of our head all the time, we can get those flat spots. So there's some big perks for it there as well.
Absolutely. Those are all things that any mom would be concerned about, or any parent when they're initially having a baby as well. So very applicable to across populations. So maybe walk us through the basics of baby wearing. Maybe what's the best way to wear a baby? What types of ways can we wear a baby? What types of carriers are there? Kind of give us the rundown, because I've worn babies, but I know I haven't been wearing them right.
And it's hard because there's not enough support. Like I said, there's not enough support for moms to learn, but that's why we're here. I have some carriers next to me that I'm going to kind of show. So there's a lot of different options, but kind of the main 6 groups, I would say. Something called ring slings, which you have these rings on the end, and then it's basically a long piece of fabric that you loop around yourself and you'll put baby into. These are really nice for newborns, and they're really nice for kind of quick in and outs as baby gets older. All of your weight is going to be supported on one shoulder, so it's not as great for longer carries as baby gets heavier. But these are really great for nursing in. So these are really nice for little babies. There are also things, this is another really common one for newborns that you'll see. This is called a stretchy wrap. So some really common brands of this are like Moby wraps or Boba wraps. This is a Solly wrap, but it's just a long piece of material. They're very long, and they've got a little bit of stretch to them. So you wrap them around yourself a certain way, and then you just kind of pop baby in there, and you can pop them in and out all day. These are really nice for, again, for new babies, for smaller babies. You can just wear it. When I was a new mom, honestly, I wore this instead of a shirt, and it was just skin to skin all day long. So these are really nice.
What a great idea.
Yeah. There's also kind of another version of that. It's called a woven wrap. So something like this, where the fabric is a woven material. It doesn't have any stretch to it. So you can wrap these a lot more ways. They're more supportive as baby gets bigger. So these are a really great option for wearing toddlers or bigger kids, because they can support a ton of weight. They don't even have a weight limit. So those are fantastic for, as you know, if you have a bigger kid that needs to be worn for some reason, then those are really nice. This is a traditional Japanese carrier. It's called an anbuhimo. They're basically like a little backpack. They don't have a waistband. These are wonderful for pregnant moms who want to wear their older baby, because they don't put any pressure across your abdomen. These are also wonderful for like wheelchair users or something like that, where you're sitting and you don't want to have that bulky waistband around you. Probably the most common type of carrier that we see around and about is something like this. We call this a full buckle style carrier. It's got a waistband. It's got the shoulder straps. Baby sits in here. You can usually wear it on your back or your front. These are very common, and there are a lot of people that don't know how to use them correctly, so they don't find them very comfortable. But when you do have the support to learn how to use it correctly, they can be really great for kids of all ages. And then the last one that I'm going to show you is called, this is a traditional Chinese style carrier. This is called a Mei Dai, and it's kind of a mix between a woven wrap and a full buckle carrier. It's all fabric material, and it's kind of a rectangle with straps coming off all the corners. And so it's similar to a full buckle in structure in that it has a waistband and shoulder straps, but it's more similar to a wrap in that you can tie it different ways. It's all fabric, it's all soft. These can be really supportive also for older kids, depending on the material. And then I want to run through kind of the safety checks for baby wearing real quick. Is this a good time to do that? So
Absolutely. That's what I was thinking. How do I know the baby is safe and
Yeah,
when it's safety tested?
that's the most important thing, right? We want to make sure that we're, even if it's not a perfect thing for us, we want to make sure that the baby is safe in there. And so our acronym that we use for safety checks is TICS. So TICKS. What you're looking for is you're looking for the carrier to be tight. You want it to be tight across yourself. You want all your straps to be tight, and you also want the fabric to be tight across your baby. The I is for in view at all times. You always want to be able to see your baby's airways. You want to be able to see their nose and mouth. You don't want it to be covered by any fabric. You want to be able to look down and make sure that their airways are clear. The C is for close enough to kiss. So you want to be able to just kind of bop your head down and be able to kiss the top of your baby's head without having to really strain down there, you know? That way you can make sure that your baby is up high enough on the firm part of your chest, so that they're not going to get into a position where they might be at risk for suffocation. K is for keep chin off chest. So again, that's to kind of mitigate that suffocation risk, that positional asphyxiation risk. Little babies, they don't have a firm airway yet. Their airway is kind of like a spaghetti noodle, and if it folds too far, it blocks. So we want to make sure that they're keeping their airway straight enough to be able to breathe. So we want to be able to make sure that we can fit at least 2 fingers between their chin and their chest while they're resting on us. If they get down too far, then they're at risk for blocking that airway. So we want to make sure that that is nice and upright. And then the S is for supported back. We always want to make sure that the carrier is tight and smooth enough across the baby's back that they're not slumping in the carrier, because that again can be a risk for positional asphyxiation. So the best way to do that is to just kind of check. Once you've got your baby all strapped in, you put your hand on their back and you just give a little light pressure. And if baby feels like they have to move at all or straighten up, then it's not snug enough. You want it to be nice and snug so that if you put a little light pressure on their back, they just stay right where they are.
Awesome. So for any ability level, these are the things we need to keep in mind when we're wearing our babies.
Yep.
So I'm glad you talked about the safety checks, Laura, because I think a lot of people who might be listening to this, they might see that article posted by the American Academy of Pediatrics. And I know we kind of talked about that, about the risk of injury and hospitalization. And it said like one of the most common carriers where infants or babies are being injured is the sling carrier. So can you shed light as to why that one would be more common than any of the others?
Absolutely. So the ring sling carrier that I talked about earlier, where it's just one loop of fabric across your body, there are some old infographics and old user manuals even floating around the internet that show a position in that carrier called a cradle carry, where the whole baby is kind of inside the carrier, like you would hold them in arms, you know, with their head here, their body here. When you put a baby in a carrier in that position and you have fabric pushing on the back of their head, it does, it can push their head forward into that position where we get chin to chest, and that can cause positional asphyxiation. They're also at more risk when they're covered up like that they're going to have fabric covering their face or something like that. So typically when we see those injuries from slings, or God forbid, you know, asphyxiation in slings, it's because people are using them in a position that's not considered safe any longer. They used to sell a product too called pouch slings, and those aren't even sold anymore. They were all recalled because of that unsafe positioning. So you'll still see them, you know, on Amazon and
Sure.
on those websites where you can buy everything from China where they're so cheap and you're like, oh, what a great deal. They're not safety tested and they're showing unsafe ways to wear those. So so those are the ones that are a little bit scary.
Well, and yes, and so that's very informative. And then the authors of this article also said that there is need for rigorous parental education. So I think about OT's role with new moms and you being certified. What a great area for OTs to emerge in with practicing either in early intervention, outpatient clinics, but even community sites with young moms.
Yeah, I think it's a big area of need. There's not enough support out there. There's not enough education out there. And we see families when they have challenging kids. We see families when they have little babies fresh out of the hospital or even in a NICU setting. And so I feel like we are a really vital touch point for those families who might be able to use these tools, but need to know how to do them safely.
So what about a baby, and I know we kind of talked about this, that has oxygen or any sort of monitor? How does that work with sling or baby wearing, and which type of carrier do you feel would be the best? Or does it depend on the size?
Yeah. Usually with monitors, they don't interfere too much. Something like a wrap or a sling tends to be a little bit more customizable, I guess. So you can kind of wrap the fabric in a different way, or, you know, slings are really easy to get them into without straps in the way or anything like that. So you can get them in without their wires or leads or anything interfering. A lot of parents, when they leave the hospital, they'll get a backpack or a shoulder bag for their oxygen tanks so they can just strap their baby on, strap their oxygen tank, and go about their day. And it actually can be a really great tool for those families who feel kind of tied to the wall because they've got all these monitors. But if we can get the portable packs and get them baby wearing and get them all, you know, they'll feel like they're hands free for the first time since their baby was born. Because, I mean, you've already got your hands full with a newborn, and then a newborn with extra things going on, it's really hard. So giving those parents a tool where they can feel more confident getting out into public and, you know, and getting their baby out for walks, that can be really important.
Absolutely. I'm thinking already, like, we see OTs intervening in the NICU for things like this, for self-feeding, but we don't, they're helping the baby latch and things like that, but we don't see the OT being called for the mama side in the acute care. So I know, at least from my personal experience, I was offered someone like a lactation specialist, or if there was someone having difficulty walking after a C-section, they'd have PT, but never is the mom having the opportunity to see anyone with this type of information in the hospital at the right place at the right time when they could benefit from this information. Are you seeing this offered anywhere, or any other, where is this being done?
We do have in our NICU, I've got one colleague who's very interested in baby wearing. She's not a certified educator yet, but I've collaborated with her a lot on kind of how to bring this to parents in the NICU, and how to make safe recommendations for those babies. But I would love to see it used more. I would have loved to have this as a new mom in the hospital, just to know how to keep my baby safe. Because yeah, I had lactation consultants coming by, I had the car seat technicians coming by telling me how to keep my baby in safe positions, but then nobody coming by telling me how to do this. And for me, it was such a vital tool, and I learned everything from YouTube, and it's just not ideal, you know.
I just
So
think
it
my
would be really nice to have a professional come by and show me how to use these tools.
Yes, like that transition from being a new just a person who's pregnant to a new mother. I just can't, that transition I think would be so much smoother if I had a tool like this and I was confident and empowered in using this tool.
Yeah. Yeah. And I like what you said about like a mom who maybe had a C-section, and, you know, in a mom baby unit, what better place would it be than for an OT to come in with several different wraps, and you could practice and see which one was the most comfortable for you. And then the OT could give you information where to order them from. And, you could demonstrate a sort of almost a competence that you can safely wear your baby.
Yeah.
And then feel good about when you go home and feel like, you know what you're doing and you're not fearful of it.
Yeah. And a lot of C-section mamas will kind of avoid wearing their babies because they'll have a carrier at home that they put on their registry that looks like this. And it's got this big old waistband, and they're like, oh, well, there's no way I want to put something in that area right now. But there are so many other options that we don't all know about that could be really helpful for those parents.
Yeah. One other thing I did want to bring up though is the position of the infant's hips. Can you talk a little bit more about that? Because I'm sure some OTs out there watching this will be Googling and seeing an article on the positioning and on hip dysplasia.
Absolutely. So when we think about hip dysplasia and wearing, there are carriers like this, and then there are other types of carriers that, again, have the waistband, the straps, and everything, but they have a more narrow base down here. They tend to be the more inexpensive ones, like the Infantino carriers that Walmart carries, but even, Babywearing is always my example. It's always the carrier that you see on movies. It's always the carrier that you see movie dads wearing with their babies facing out, and they've got their little legs just dangling down. And that position with the legs dangling can be very stressful on new hips when we don't have tight ligaments yet, and especially for babies who are breech or who are for some reason at higher risk for hip dysplasia. When you have them in a position where their legs are dangling like that and they don't have any support at the hip joint, that can make hip dysplasia worse. If you have a baby who isn't predisposed for hip conditions, typically wearing won't create hip dysplasia. But if baby already has risk factors, then it can make it worse, if that makes sense. However, if you have a carrier like this and you have the nice wide bottom, and you get baby in the right position, which is kind of an M shape with their legs, so they want their bottom a little bit lower than their knees, and then their calves will come down like that. That's actually essentially the same position as a Pavlik harness that your baby would be in for hip dysplasia. It's actually a very supportive position. It's a very ergonomic position. And baby has support all the way from their hip joints out to their knees. So there's no stress on the hip joint at all when you have baby in that ergonomic M-shaped position. And most carriers will support that M-shaped position. So all of the carriers that I showed you at the beginning, if you have baby in the correct way, it will support that M-shaped position. So there are lots of safe ways to wear a baby who's at risk for hip dysplasia. There are even safe ways to wear a baby that's in a Pavlik harness. You just have to make sure that you have the right carrier that's supportive. The other thing that I do want to bring up is I know I talked about those pouch slings earlier where baby's kind of at risk for that chin to chest. They are also at more risk for hip dysplasia in that position because it puts their legs together and straight, which is something that we want to avoid. I know they talk to us in the hospital about swaddling and how you want to make sure that their little hips have room to move and their knees have room to come up when you swaddle them. But again, they don't talk to us about how to achieve that in a baby carrier. So that's something else to think about.
Yeah, it's fascinating. It's not, it's not the device. Essentially, it's this, what's missing is that information piece. That OTs,
absolutely.
Yeah, the OTs are uniquely trained to fulfill, or could be.
Yeah.
But what makes me think too of something we talked about was kind of this old mindset that you can hold a baby too much. Can I wear a baby too much? Will it slow down their developmental milestones? Is this something I need to be concerned about?
It won't. And the most recent research that's coming out is basically telling us you can't spoil an infant. You can't hold an infant too much. It actually helps them form a really secure bond with their caregiver, and that's the most important thing that you can be doing in those early days. A lot of baby wearing educators and and therapists will even tell you baby wearing kind of counts as tummy time. When they're in that position, when they're upright on your chest, they're engaging their core muscles, they're reacting to your movements as you're moving around and going one direction and stopping and moving this way and stopping and walking fast and slowing down, and they're reacting to that. They're engaging their muscles in a way that they wouldn't if they were sitting in a baby swing or in a bouncer, or even just laying on their back in their crib. So it's actually a really great tool for development. It also helps them be able to kind of work on that neck strength and look around and experience their environment from a different angle. So for a lot of babies, especially for babies with reflux that have trouble with tummy time and that get really fussy when you try and put them on their bellies, this can be a really nice tool to still get in some of that strengthening without having to put them in that position where they're miserable. As an OT, I will add the caveat that I do think tummy time on the floor with like free exploration, I think that's really important, because you do get that movement piece of how do I move my body? How do I reach for that thing over there? How do I roll? I do still think that's very important, but if you've got to choose between putting your baby in a swing or putting your baby in a baby carrier and wearing them, the baby carrier is better 100%.
Fantastic. I'm thinking, so we discussed a couple areas where it would be beneficial for children with special needs, such as oxygen or things like that. Can you think of any other situations for the infant or for the child where it would be beneficial? Perhaps orthopedic challenges or sensory needs. And then we could talk about as well the benefits for a mother who is atypical as well.
Sure. In my practice, I've seen a ton of different applications for baby wearing where it's been really helpful for the kiddos, ranging all the way from NICU babies, preemie babies, especially those who were born with drug addiction or anything like that, where they're just really, really fussy. And some of those babies are just really, really hard to console. Baby wearing is a great tool in that situation to just kind of give them that contact that they need and that constant security of having a caregiver nearby who can quickly respond to their cues. That is a great way to help those babies cry less and help those caregivers feel more successful because their babies are crying less. I've also seen really great applications with some of my older kids and toddlers with autism who have really intense sensory needs. A lot of our autistic kiddos really seek out that proprioceptive input. They want squeezes, they want to crash, they want big bear hugs, and putting them in a wrap or a carrier can really achieve some of that, give them some of that all over proprioceptive input that they're really looking for. So that can be a really nice way to help support our kiddos with autism. And also, a lot of my kiddos on my caseload, I know, are kind of runners. They would get out of the car and they'd just be straight off into the store without any regard for where the cars were or anything like that. If a mom can take her kiddo out of the car seat and put him right in a carrier, she knows that that kid's going to be safe. And so that's also been a really nice tool. And then in Colorado, there's so many ways. There's so many great.
We want to hear them all.
To these kids. But in Colorado, I mean, we're really outdoorsy here. We like to hike. We like to camp. We like to go places where there aren't necessarily paved trails or wheelchair ramps. And it can make it really hard for those families who have, especially ones who have multiple children, and one of them's got some kind of physical disability that makes it harder for them to keep up with their siblings or even just to keep up with their parents who want to be out there. It's not necessarily everywhere they go, you can't necessarily bring a stroller or a wheelchair. So being able to get those families with a carrier that fits them and that supports that kiddo well, that can really just help families feel like they're living the life that they want to live, which is what OTs are here for, right? So that's been a really nice way to use it as well.
Mhm.
I love that example about the child wearing, not just baby wearing, but child wearing, right? It's designed can be used for older children as well, and that didn't
Absolutely.
initially come to my mind.
Yeah, absolutely. There's ways to wear kids essentially up until you can't physically lift them anymore. You can put them in a woven wrap, especially. And there are some specially designed carriers for special needs as well that have higher weight limits. So
I think about the foster care families I've worked with, and many had infants who were prenatally exposed to drugs, and I just think what a great tool this would be for them, free them up as well, because you're right, those babies cry a lot, and just having that contact and that movement, that vestibular and the proprioceptive input. Usually I would see those babies calm a little bit more once they were starting to get mobile.
yeah,
This would just provide something that would really help the foster care parents be able to uh, care for that baby in a different way and not feel as exhausted, because many of them
yeah,
are exhausted.
yeah. I do think that foster care in particular is an area um, where OTs could support families more. And I think baby wearing would be a great tool to employ with that population.
Yeah. Jenni had brought up, let's talk a little bit about the moms. So it makes me think about moms who have special needs, whether they're, have a spinal cord injury, or they have MS, or anything like that, CP. What can you share about that?
Baby carriers are wonderful for those moms. It can provide a way for them to hold babies securely while still having their hands free for wheelchair mobility, or if mom has limited use of her upper extremities and feels like she can't safely hold her baby with her arms, this gives her a way to still have that baby close to her and give her that skin to skin and give them that opportunity to bond without her feeling like she's going to drop her baby. And it can just be a really vital tool for those parents who want to be able to safely transport their baby and be able to take care of their child without somebody else kind of hovering around all the time. A lot of times those parents will like a carrier like the slings, like the ring slings, because they're very easy to adjust with one hand. They don't require doing buckles that might be challenging if you have limited fine motor control. They don't have a waistband like I talked about earlier. Sometimes wheelchair users, they don't feel comfortable with that big bulky waistband around their waist. And so there's still lots of options that you can use that would be comfortable in that position.
Absolutely. I'm thinking of in my, even in hospital settings, working with young women who've had brain injuries or strokes or, often, it could be related to drug use or just bad luck, but making this part of their ADL education right away, like not making this something that the patient necessarily has to think of, that it's something that's already in our OT toolkit, that we're introducing it as a way to solve their problems, to restore those lost roles. So I can just see so many ways to apply it, not in the hospital, in inpatient rehab settings as well, where it's at the forefront of our mind. So
yeah, and it can also, especially with moms of infants who are breastfeeding or still on a bottle, it can be a really great way for them to be able to, especially like moms who have had strokes and only have use of one upper extremity, if they're able to wear their baby while they're feeding them, that can be a really nice way to feel like they've got their baby well supported and they can still take on that role of being the person who provides their baby with nutrition, which, as we know, as moms, that's one of the most important things that we feel like we can do for our babies in those early days. So I think that's a really vital part of that role that we can support.
What about cost? We've talked about the different types of carriers, how we could use them, but and you talked about like you can buy them very inexpensively, like at Walmart, but where would a mom find some of these carriers and how much would they cost?
I do think that that is kind of one of the barriers right now for baby wearing. Um, and I think that's kind of a challenge that, you know, as OTs, I think we could kind of dive into community resources for them and help with that support. But like some of these carriers, you know, if you were to buy this carrier brand new, it's almost $200, which is way out of reach for a lot of our families.
Mhm.
You can buy them secondhand for a lot cheaper, but that cost still might be out of reach for a lot of our families. Some of these other carriers, like the woven wraps that I mentioned as being really great for older kids, these can be, I mean, if you get like a hand woven silk wrap, these can be thousands of dollars.
Wow.
I know. But there are also ones that are a little more inexpensive, but it takes a lot of research, you know, and it takes a lot of time spent looking at all these different websites. They're not typically available in your big box stores like Walmart or Target or Bye Bye Baby. You know, they usually will have maybe 2 or 3 different types of carriers, but they won't carry things like the woven wraps or the May dyes or the ombuhimos that we talked about. Those just aren't easily accessible. So one thing that the baby wearing community has kind of done to make this more accessible for families that need it and can't afford it is a lot of baby wearing support groups have kind of popped up around the country. And I volunteer with our local group here. They tend to provide free education for one thing. So you can come with your own carrier and get a free fit check. You can also come and they usually have a library of carriers. So all different kinds of these carriers that I showed you here today, they can come and check out and just see like what else is out there other than this horrible carrier that I got on my baby registry that I'm now discovering doesn't work for my body, you know? And so they can come and kind of see what else there is. We have a system set up, and I know several other baby wearing groups do, but I'm not sure about all of them, that you can rent carriers for the month. So for ours, it's a $30 donation annually. And then you can rent a different carrier every single month, which makes it a lot more financially accessible for most people. So there are some ways that we're getting around that, but it's still a barrier, I think, because those resources aren't necessarily available in all communities, especially rural communities. And that, you know, like I said, you really have to dig for some of that information. Sometimes it's not easy to find that. So if you've got people who have their hands full with a kiddo with special needs or a foster family, that may not be at the top of their list for things to find out about. So we need to make it easier for them to get their hands on those resources.
Well, you talk about the cost, but what if you ordered one, then you didn't like it?
Mm-hmm.
You know, so I like the idea of being part of something where you can rent a different one each month and find which one you like the best. But you're right, it's probably not an option for everybody in every community.
Yeah.
Do you ever see any clinics offer like baby wearing classes? Like you said, you saw stuff on YouTube, but what about like in-person courses or clinics for moms?
I haven't in my community, which we are now working to make that a thing. But it wasn't a thing when I was a new mom. They briefly touched on baby wearing in like my birthing class where we talked about, you know, birthing and breastfeeding and all that stuff. They kind of talked about it for like one slide. They're like, oh yeah, and you can put them in a carrier. Let's move on. You know, so they didn't really give us the information that we needed. And so we are now working with a group of doulas in our community that provide a lot of postnatal support for moms. We're working to educate those birth workers and helping just kind of spread the knowledge around. We're working on linking up with pediatricians' offices to kind of get that knowledge out there, and even just to get the knowledge out there that there is a support group for this in our community and that we do have this resource and you can come and it's free. And, you know, people just don't know about it. So I think that that's still something that really needs to be more works towards. That needs to be a big goal in all our communities, because yeah, we're doing it here, but that doesn't mean that it's happening everywhere that needs it. So
What a great idea for consulting as an OT,
Mhm.
consulting with these pediatricians. Of course, went through a baby course when I was pregnant with my first child. It's very common and a great opportunity for us to intervene. And then even those OT like in-home services where we are in their homes and we can intervene right at that point of care. So a lot of
yeah.
great opportunity for OT consultation in this area. You're doing
Mm-hmm.
such great work, Laura.
Thank you. I think it really, especially early intervention workers and people who are working in a hospital setting on those mom baby units or in the NICU, or, even OTs in primary care. We know that's an emerging practice area. So if we've got OTs in primary care who are also working with and maternal care, then that could be a really great way to just kind of get this information out there, because it supports all our great OT things. It supports physical development, it supports social emotional development, maternal mental health, all of it. So I think it really could be more woven into our OT practice in all those different areas.
So how would one explore getting a certification like what you have?
So with the certified baby wearing educator, which is what I am, I did a class through a company called Massimi Birth Services. There is no one like overarching thing. Like we have NBCOT, for our OT certifications. Baby wearing doesn't necessarily have that. Although I will say that probably the biggest organization for certifying baby wearing educators right now is called CBWS. It's the Center for Baby Wearing Studies. And they do have several different courses. They have an educator foundations course. They have a newborn baby wearing course, which I'm actually taking right now, which just focuses in on what can we do to make those tweaks for newborns to make sure that they're safe in their carriers. They actually have a certification for healthcare workers, which is a new course. I looked a little more into it after you brought it up, Jenny. Right now, I think they're just offering it to banner employees, but it looks like they're looking to expand in the future. So that's very exciting. I think that would be a great way to get nurses and OTs and all these people that are interacting, pediatricians, all these people that are interacting with new parents, to get that knowledge and to get that knowledge out to those parents, because, especially in those early days of parenthood, the only things you're leaving the house for are doctor's appointments. The only people you see are medical professionals. And so we are the ones that they are touching base with, and we are the ones that need to be making sure that they have that information.
Fantastic. Where would you recommend we send mothers who want support in this area? Where are the most support groups located? Where have you had good luck finding that?
Honestly, the best luck that I've had finding support, and I think what's kind of the most universally accessible is Facebook. There are a lot of groups on Facebook that will provide fit checks. You just post pictures of yourself wearing your baby in your carrier, and educators or experienced wearers will chime in and tell you, what kind of tweaks you can make to make sure that you're safe and comfortable, or if you might want to try a different kind of carrier. That's where I got a ton of my knowledge in those early days. So even though it doesn't sound super professional, some of those Facebook groups are really great resources, and they are more accessible to people who might live in rural areas and don't have that access to in-person help. So some of those groups that were really helpful for me there's one called Babywearing 101. There's one called Everyday Babywearing. Both of those groups are just really nice introductions to baby wearing, and they'll help you figure out how to keep your baby safe and comfortable.
Awesome. And we're not just looking for ways to educate ourselves as OTs. We want to give our clients resources. They don't necessarily always want that healthcare worker or that specialization. We want to know where to send them when they want community support. So that's fantastic to know that there's a growing body of support out there. And I know I did see there's a local Quad Cities one as well. I don't know how how common it is or how far down in the process they are, but it's definitely popping up in our communities.
Yeah. And one thing I want to throw out there as well is, you know, for me being a part of one of these local baby wearing groups, we're all inclusive. You don't have to be a parent with a baby to come learn more about baby wearing. You know, if you're a healthcare worker or a doula or somebody who just has a lot of contact with new parents, or, you know, you've got a friend who you think needs some help with this, we welcome anybody who wants to learn more about baby wearing. So that's another resource for OTs as well who want to learn more about it. Look for your local support groups and look for those local experts in baby wearing, and they will welcome you with open arms, because all we want to do is spread the word and spread the knowledge so that these families can be more supported.
Awesome. Well, Laura or Julie, do you have anything else for our guest here?
I don't think so. It's just so interesting to me. And it makes me really excited for our profession that this is another way OTs can support moms in that transition to motherhood.
Yeah.
And it also, you know, made me think about moms of multiples, how that would free them up as well. So it's such a great place for OT, and it just makes me excited because our profession continues to evolve, and I love these emerging practice areas. I really want to thank you for giving us your time.
Sure, yeah. Well, one more thing, you brought up multiples. There's also ways to wear multiple babies at once. So, and I know that a lot of times OTs, early intervention specialists, especially, will be in contact with those multiples moms because they tend to be premature. So there's also ways to help those mamas with too many babies.
That's amazing.
You can wear 2 babies at once and free up your hands, and that can be quite the lifesaver for some people. So.
I know my mom would have appreciated that when I was a baby. As a twin, she would have appreciated it. Well, thank you so much for your time, Laura and Julie. I appreciate it. If you have any follow-up questions about this topic or any other areas of interest you'd like to look into, you can contact us at ot@sau.edu. And please fill out our survey in order to get a certificate of completion for this course. We appreciate having you. Thank you.
Thank you, Jenni and Laura.